Hi, Karen and Tina. This is Dick Bell. I wanted to show you what I have done thus far on the case. Uh, this is the opening screen. I have this guy. I'm photoshopping his appearance. It's still not done. Uh, but the student will get a set of instructions about how to use the site. And then they start the case. So it's a 45-year-old man complaining of feeling sick and pain in his belly. And then to take a history of the present illness, they press the history button and they choose the questions that they want to ask. And submit those. So I'm having a little trouble with the order in which these are being displayed, and I'll keep working on that. But he comes into the emergency room with a bad headache, hot and sweaty, and then uh, diarrhea and vomiting. He's getting cramps in his abdomen, no blood, fever at home, and muscle aches. And then after they get that history, they need to go back to the case story in advance, and it asks them if they want to take a past medical and surgical history, and if they do, they click these, and that's pretty much negative. Family history. Is also unremarkable. As a social history. There is then the travel and occupational history, which is important to this case. Have you traveled outside the U.S.? What vaccinations did you get? Just returned from a trip to the Congo. Got the usual vaccines given to most patients. I threw in a kind of a red herring here about working in the insecticide industry. I asked about rat and tick exposure. Then they get a chance to do the physical exam, and they can do as much of this as they want. Probably winds up being essentially everything. He has a fine maculopapular rash. You can see the other results here. And they go on, and they have to choose a diagnosis. And so if they go into infectious and parasitic diseases, they'll see this group of fevers. Yellow fever might be one that they choose, and then they can go back and pick some others. So here's Marburg and Ebola. If they submit those, then their differential appears over here so they can remember it. And now it says a left anticubital IV is put in by the ER staff. Patient is getting Ringer's lactate. You leave for about 10 minutes to see another patient. When you return, you notice the patient's bleeding. And I'm going to put in another picture here. I'm going to Photoshop it and try to make it look like the patient is bleeding from his puncture sites and developing some petechiae and bruising. And then they're asked to revise their differential diagnosis in response to that. So they might get, I don't know, might get rid of yellow fever, I'm not sure. And submit those. And then it says, before concluding this portion of the case, we would like you to answer one multiple choice question related to the case. And it says, do a web search about vaccinations for travelers to Democratic Republic of the Congo. Only one answer is correct. Let's say I choose the wrong one. And then we'll submit. And then you do your scoring and your feedback. They had some points deducted for the multiple choice question, but otherwise did okay. And that's the end of the case.